Hello and welcome to Dialogue. The World Health Organization has declared that COVID-19 no longer poses a global health emergency. But head of the WHO, Dr. Tedros Adhanom Ghebreyesus, warned the removal of the highest level of alert did not mean the danger was over. So how should we understand the current situation? How should the countries continue their pandemic management work? And is it possible to develop a COVID vaccine that is safe and effective and can completely eradicate the virus? To discuss these questions and more, I'm glad to be joined by Dimas Tadeu Covas, Professor of Medicine at the Faculty of Medicine of Ribeirão, Preto, University of São Paulo, Dr. Alexis M. Kalergis, Professor at the Schools of Biological Sciences and Medicine at the Pontifical Catholic University of Chile, and Dr. Eric Gall, Medical Affairs Director at the Sinovac Biotech LTD. That's our topic. I'm Xu Qinduo. So Dimas, I will start with you. And please help us understand the situation is no longer an emergency, but remains a danger. What does it exactly mean?
WHO has declared that COVID-19 no longer presents a global health emergency. But it is important to note that this not means the virus is no longer a threat. The pandemic is still ongoing, and it continues to pose a significant danger to public health around the world. WHO has emphasized the need for continued vigilance and the actions to control the spread of the virus. The danger of coronavirus varies depending on factors such as individual health status, age, and underlying medical conditions. For some people, the virus may cause only mild symptoms or no symptoms at all, while for others, it can lead to severe illness and even deaths. In general, the virus is more dangerous for older adults and the people with pre-existing medical conditions. Controlling the danger for coronavirus requires a coordinated global effort, including robust public health measures such as testing and vaccination programs. While developing countries have made significant progress in controlling the spread of the virus through these measures, underdeveloped countries may face greater challenges due to limited resources and infrastructure. International cooperation and support are crucial in ensuring that all countries have the tools and resources they need to control the pandemic.
Professor Alexis Kalergis here, of course, people say, just as we discussed, it remains dangerous. But to individuals, in terms of our daily behavior, is there any change? I mean, can it still as lethal as in the past? After all, 3 years, has been gone there. So can we just somehow let down our guard a little bit?
I think it's important to state that the virus is still with us, and it will be with us for a long time. So the first measure is try to avoid getting infected. In other means, try to avoid situations that are high risk of infection. For example, crowds. Try to use a mask, face mask, when you are in the public transportation, for example, in order to avoid exposure to the virus. Secondly, it's very important to be up to date with your vaccine program. Every country has a different vaccine program. And as we know, science and medicine have been very active during the pandemic in order to provide and develop safe and effective vaccines. So it's important that people not only get the primary vaccination program, but also they need to get the boosters. As we know, boosters have been very important in order to reestablish vaccine effectiveness, because the virus is able to change, and as we have observed during the pandemic, the variants could be very challenging for immunity triggered by the vaccines. And therefore, it's important that people are up to date with the vaccines. And finally, I think it's important that governments in every country, they spend efforts in terms of following up cases. So diagnosis is very important. It's important that we continue diagnosing COVID-19 in order to just have a pretty good idea of the epidemiology of the virus. And just a bonus track point is long COVID. Long COVID is a big problem. People that have been exposed to SARS-CoV-2 might develop this long-lasting sequela that we still, with science and medicine, do not fully understand. I think it's important that we continue doing research on COVID-19, especially in long COVID.
Mm-hmm. Well, Eric, we talked about the individual behavior. I mean, speak of the daily lives. For example, in Beijing, basically the subway or the bus, they will not require the passengers to put on a mask, for example. Do you think what kind of caution should people take probably to protect themselves?
Yes, I think for individuals, they should still pay more attention about the news or information from public health authority. We know that the lifting of this international alert or highest international alert doesn't mean there's no threat about the virus. But compared with previous Omicron variants or other previous lineage of this SARS-CoV-2, there's no significant change about the variant or the virus, or there's no change about the virulence compared with previous strain. So basically, there's no special precaution about the personal protection, but we should follow the instruction from the public health authorities.
So Eric, a follow-up question is, for example, one is get infected, unfortunately, I mean, how dangerous or, what about the level of getting probably hospitalized or even putting into ICU, that's unit?
Yes, it's a good question. But based on the surveillance data from released from China CDC or public health authorities in China, so the current strain, we call that maybe BF7 or BA1.5. So the virulence of this virus or this strain is not significant, severe compared with previous Omicron strain. So basically, I think there's no additional concern about this new variant. So just keep following the instructions by public health authority in China. I think this is fine.
Mm-hmm. Professor Dimas Covas, you talked about, I think all of you agree that, we cannot let the guard down, in particular for the government. But still, what kind of impact will WHO's decision bring to countries' COVID management work during this post-pandemic period, let's say?
Okay, WHO actually, they transfer to the countries the responsibility to deal with the pandemic. Now, each country has his duty to put all the measures that they take before now in regular basis. So every country needs to adhere with the strict vigilance rules, maintaining all the attention to the new cases, to the hospitalization cases, and that number of COVID cases. So it's up to each country to take all the measures that is necessary to control the virus, because the virus could, as you know, could evolve and a new surge is also possible. So all the vigilance is necessary in that new period.
Okay, let's take a look at the specific situation. For example, in China, Dr. Eric Gao here, reinfection of COVID-19 have been widely discussed on Chinese social media recently after a bunch of people posted their positive antigen results. Should we worry about a new wave of COVID-19 here in China?
Yes, I have heard lots of discussions about the reinfection, not just in China, but also in other countries like US or Europe. They all have such kind of experience. But for me, I think it's just because they're winning about the immune antibody, whether it's generated by vaccination or natural infection. So after several months, like 3 months or 4 months, the level of the antibody will drop. So it's and also because of mutation about the virus, the new Omicron strains. So there's a challenge for the vaccine or even the vaccination or the natural infection to prevent the new Omicron strains infection. So basically, it's a common phenomenon not only in China but also in other countries. So I don't think that we should worry about that. But for some people with high risk, for example, for the elderly people, for some people with some like chronic disease or some other health conditions, yes, they should take some regular precautions or measures to avoid infection. So this is what I think.
Mm-hmm. So Eric, how is China or how are the countries you mentioned they are responding to the surging reinfection number, especially in terms of protecting the elderly and and patients with underlying disease?
Yes, in other countries, just like Chinese, I think there's no difference because we know that the new variants, the new Omicron variants now circulating in the community. So the virulence, the disease severity is not significant change compared with other previous SARS-CoV-2 virus. So there is a close monitoring about the virulence of the virus. So if there any change about this virus or any disease severity about the COVID-19, so there will be an alert from the public health authorities or from the government. So I don't think that we should pay more attention or worry about the reinfection situation in China. But for people, just as I mentioned, for some very specific population like people with diabetes, with other chronic disease, they should pay attention about those situations.
Mm-hmm. Let's have a short break. We'll be back right after this. Welcome back. Dimas, how concerned are you with the possibility of a new strain that may throw the world again into chaos?
Oh, the emergence of new strains of the virus is a concern. As you consider that these strains may have different transmission patterns or may be more virulent than previous strains. This could lead to increases in cases and the potential overwhelm healthcare system. So it is important now to know that the vaccines have been effective in protecting against many of the new variants of the virus that have emerged so far. And the vaccine manufacturers are also working on developing booster shots and updates the existing vaccines to provide protection against the new strains. While the emergence of new strains is a concern, it is important to continue to monitor the situation closely and take proactive measures to prevent and control the spread of the virus. This included also the ongoing surveillance and the testing to find new variants and also to invest in vaccine development and distribution. That is the main action that you need to put in actions in all countries around the world.
Mm-hmm. Dimas, there's a perception, or I don't know, like a misperception probably. People would say as time goes by, the new strain or new variant will become weaker and weaker or less lethal. Is that the case?
I don't think no. It's not possible to control the evolution of the virus. The new variants are being generated also now. So it is important to know the biology of the virus. The virus is in evolution. So it is possible to make the evolution in terms to be a weaker virus or on the contrary, to be a stronger virus.
Okay, we know the evolution is hard to control, but Alexis, vaccines, as you said, were one of the major turning points in the pandemic. So I wonder, where are we now in terms of the vaccination, in terms of the, efficacy or effectiveness of vaccine to stop the spread of the virus?
So we need to keep in mind that when this new coronavirus arose, the humanity had no immunity for this virus. So we had to get pretty much every person in the world vaccinated, otherwise it could be susceptible to get sick out of the infection, especially as Dr. Gao said, if people have any kind of comorbidity, right? Some, base chronic diseases. So it is important that we have that in mind, because having everybody up to speed in terms of immunity, it takes time and also takes better vaccines. We learned during 2020 and 2021 that effectiveness of vaccine with the emergence of new variants of the virus was going down, and that led to the need of boosting, right? Boosters. Now, there are two things I want to say about vaccines. First, it's very important that vaccines are updated with the circulating current variants of the coronavirus. It's important, and that is something that science and medicine need to work on, getting updated vaccines in order to lead to specific immunity for the current variants. But also we could start thinking on something that has been discussed for many years in reference to influenza, something that could be sort of a universal coronavirus vaccine. That would be the goal, just to have one type of vaccine able to recognize areas of the virus that do not change in the variants. Mm-hmm. And also keep in mind the possibility of immunizing through the nose, for example, to the airways. I think that could be a better way to lead to sterilize immunity against the virus. Those are my current thoughts on vaccines.
Right. Maybe it's an ideal situation. People do look forward to a COVID vaccine that is safe and effective and can completely eradicate the virus. Is it just probably a dream that, given the evolution or constant evolution of the virus?
Well, we have a great example with smallpox that was eradicated thanks to vaccination. I think it's too soon to start talking about the eradication of coronavirus, but definitely we combine different types of vaccines, not only in the formulation, including variants, but also thinking of something like a universal coronavirus vaccine, and the route of immunization might be also important. So there are different groups in the world, in different areas, group of research working on vaccines that could be administered through the nose, through the airways, so you can just control the virus right at the site of infection.
Dimas, the world has been grappling with the phenomenon of the so-called long COVID since mid-2020. Tell us more about that. According to the journal Nature, there's estimate that around 65 million individuals have experienced long COVID. So as a lot of suffering, obviously. Are there any particular research, scientists may be working on?
Long COVID or post-acute sequelae of SARS-CoV-2 infections is a phenomenon where individuals continue to experience symptoms associated with COVID-19 for weeks or even months after the initial infections. We know much, but it lasts several doubts about the physiopathology of this condition. So there is a lot of efforts around the world to identify the risk factors that are associated with long COVID, such as age, sex, pre-existing medical conditions. And also, we need to understand the biology of the virus. Researchers are studying how SARS-CoV-2 interact with the human body and how the virus can cause long COVID. And also, there is the necessity to develop treatments for these conditions. So we know a lot, but more knowledge and more research are needed to understand how is the pathophysiology of long COVID.
Yeah, more research is needed. So Alexis, there's an article published on Nature magazine saying that 3 years after the start of the pandemic, COVID-19 shows no signs of settling into a seasonal pattern of spread like influenza has. You earlier mentioned about, still there's a difference probably when it comes to winter or come to summer because of the temperature. So in your view, will we see just more, mini waves of COVID rather than seasonal surges?
Yeah, I think COVID-19 was surprising. SARS-CoV-2, the virus responsible for COVID-19, was surprising that it did not really follow a seasonal pattern. But having said that, due to the lower temperatures in the winter, people tend to be more indoors, and it's definitely the case that it's easier to get infected indoors than outdoors. So during the cold temperature seasons, I think it's important that special measures are taken, not only regarding being up to date with the vaccination program, but also maybe using face masks in places like public transportation, and every time you are in a crowd of people that might promote infection and transmission of the virus. I think we still have a lot of virus circulating, and I still have a lot of people that are unfortunately not fully vaccinated. So I think we will get a situation that is could become serious if there is a new strain or new variant of COVID-19 that might be able to evade the immune response triggered by the vaccine. Mm-hmm. Because having a strong message about the risk involving getting infected with SARS-CoV-2, being under-vaccinated, and the importance of preventing getting infected by the virus. It's important to keep that message because although WHO declared that the pandemic was over, we still know the virus is circulating and people susceptible to get severely sick due to this virus.
Mm-hmm. Well, for the past 3 years, China has provided hundreds of billions of COVID-19 supplies to some 153 countries and 15 international organizations, and more than 2.2 billion doses of COVID-19 vaccines to more than 120 countries. Of course, during the whole process, Sinovac, where Eric, you are from, played an active role in the process. So, look into the future. So what is the research right now, from Sinovac, and what kind of cooperation they are conducting or planning with the scientists around the world and the countries probably around the world?
Yes, in the last 3 years, so during this pandemic, Sinovac collaborates with many international organizations and also some academic institutions to develop or to conduct clinical trials and to also to distribute the vaccines to globally. So far we have distributed our vaccines, supplied vaccine to more than 6 countries, and totally there are 2.9 billion doses have been provided to the world to fight against the virus. So in the future, we have planned to continue focus on vaccine development. So far, we have a pipeline cover the major threat of major life-threatening disease. So this is all we are working on. So we will continue invest more to develop new vaccines.
Yeah, continue to develop the new vaccines as the virus evolves. With that, we come to the end of today's show. Many thanks to our guests. You can also find us on the CGTN app or on YouTube. I'm Xu Qinduo. Thanks for being with us. See you next time.